information is not synonymous with the truth. So it's very important to know your sources. The information on the internet can be from any source, and some of the sources may not be sources with a high index of truth. Or they may not be a respected source, it may not be a trusted source, and the information can be false. And of course, the second thing to understand is that a small amount of information, they say a little information a little knowledge is not a good thing. Sometimes people say that. It's an adage, and that's because to understand the information, you have to understand the context of the information. You need to understand how it interacts with other problems and what some of the side effects are with one item of information. If it's utilized, everything interacts. So the difference between a layperson looking up something on the internet and a physician who has been trained in these areas, the physician understands the integration of all the little tidbits of knowledge and knows how to utilize that knowledge. Also, it's more likely that a physician's going to know that whether or not this information is useful and truthful, as opposed to information that's just put out there that's not necessarily the truth. And there may be parts of the information that are true and other parts that aren't true, and you might end up utilizing the information which is part of that subject that you've looked up that's not true, which also pertains to knowing your sources. You want a reliable source. And you don't know if it's reliable necessarily just because you looked it up on the internet. And it's important to look it up and understand it, but it's also important to clarify any questions you might have and to put it up against what the physician knows. A professional can give you give you a better understanding of the importance of what you've learned, or a professional person trained can help you to understand whether or not this information is useful or not, or true or not. I would encourage a person to do his own research, that's fine, but to put the knowledge up against what a professional knows. There is this element called differential diagnosis. Differential diagnosis is when a physician or a provider sees a patient and gets intake and information about that person's history and his complaints. Well, in an office it might be different than the differential diagnosis may be different than the differential diagnosis in the emergency room. In the emergency room, we think of the things that are most serious first. Even though they may be less common or less likely, we don't want to miss it, so we put that on top of the differential diagnosis. In an office, we may add it to everything else. The patient's stable, the patient is asymptomatic, so the differential, or the patient is not in a critical condition, so the differential diagnosis may be much wider, but there's always a differential. In the emergency room, we treat the aspect of the disease that's acute, the result of inadequate care of something that's been going on, something that's chronic, or something that just came on, where the diagnosis is not apparent. That's what we treat in the emergency room. In an office, chances are we already know the diagnosis, and we're preventing sequelae, bad outcomes, by fine-tuning the patient and following the patient over time and screening for possible problems. If you had a choice between a general practitioner, and I know the general practitioners and the internists won't like what I have to say, but I think an ER physician is trained in acute care and is able to decide what a patient may have and what has to be done. But there is no time to look things up often, and so that's a difference in the clinical setting of an office. The acuity is much less. The diagnosis is already known. There's very little unknown about what's happening to the patient, and the idea is to follow the patient up and prevent what causes a patient to go to the emergency room. For instance, in diabetes, in the office, you're trying to prevent the sequelae, bad outcomes. So you try to keep the sugar at a normal level over time, but there's no acute event. In the emergency room, we're taking care of the patients who have fallen through the cracks or who've gotten worse, who have a sudden worsening of their chronic condition, and that has to be treated differently. It's important to understand that the organs and the different systems of the body, they're all integrated. For instance, the kidney, besides filtering the blood and allowing for urine to be made, also has functions in blood pressure through its regulation, through the regulation of angiotensin and renin, which are two substances. One of them is produced by the kidney, another one's produced by the lung, and those two substances together keep the blood pressure homeostatic or normal. The liver and the spleen and the kidneys all work together, and they do different things which are much less obvious. So there's a much wider understanding of the human body. Professional, like a physician who's trained 4 years in medical school, sometimes 5 to 6 years of residency, and years of experience. The width or the girth of the knowledge is much wider than, let's say, somebody who has a specific problem, goes on the internet and finds out about that problem, but is unaware of the other systems and problems that intermingle with this particular problem. I've had, 4 years of medical school, 3 years of general surgery training, and I had 3 years of emergency medicine training. So that's 6 plus 4, that's 10. Following that, I had to take the oral boards and the written boards. And every 10 years, I have to renew my boards by taking a written exam. And I've been clinically working as a physician, following my residency training, my board certification. I've been doing what I do for more than 30 years. At this point in my life, I haven't really been surprised. But when I first started, I had a lot of surprises, I have to admit. And there are times when I didn't know exactly what to do, but at this point in my career, I've seen so many things that I generally know off the top of my head what I have to do. And I know that sounds presumptuous, but it is true.